Hello, everyone, and thank you for joining us today for the SBCA 2020 European Conference webinar. Before we get started, I'd like to cover a few housekeeping items. The session is being recorded. The recording will be available via the SBCA website following the event. All attendees have been placed on mute upon entering. We ask that you please remain on mute for the duration of the presentation. Time has been allocated at the end of the session for Q&A. If throughout the session you have any questions, please feel free to use the chat feature on the bottom of your Zoom panel. Once the presentation has been completed, time permitting, we will answer questions at that time. I'd like to turn the presentation over to Heinrich Andersen. Heinrich Andersen is an associate professor at the University of Toulouse and researcher at the Toulouse School of Economics. His research covers the areas of environmental health and transport economics. Heinrich has published several scientific papers, including some on the value of a statistical life, risk perception, and transportation noise. He's also been involved in several international scientific conferences, either as an organizer or as a scientific committee member. Heinrich, please take it away.
Thank you very much, Kevin. So I will take this opportunity to welcome you all to this webinar. So I'm a board member of the Society of Benefit Cost Analysis, and I'm the chair of the scientific committee of the European Conference. And we lost the slides, Kevin. At least I did. So I welcome you in that role as both a representative of the society and of the European Conference. And I will just say a few words about society and the European Conference. I will not take away any valuable time or as little time as possible from Jason and John. But the society was founded a little bit more than 10 years ago at the University of Washington, and its mission is to advance economic evaluation, both from a research perspective, but also when it comes to policy, so the implementation of economic evaluation policy. So not only benefit cost analysis, but also other tools like cost effectiveness analysis. And the society has organized a conference, an annual conference in Washington for a little bit more than 10 years. As many of you know, unfortunately, this year, the conference was canceled, but I'm very happy to announce that we are planning for 2021. So please keep your ears and eyes open for information about next year's conference. And also, since I'm European, I'm very happy to announce that we had the first conference last year, European conference last year in Toulouse. And the plan was to have it this year in Stockholm. But since we're here, that didn't happen. But hopefully next year we will meet in Stockholm. But for more information about the society, please visit the webpage. You have the link here. You can find a lot of information about activities, events, etc. that happens. Not only conference, but several events happen over the year. So please visit that site. And we also have a journal. The site has a journal, the Journal of Benefit Cost Analysis. And it's a journal, of course, devoted to benefit cost analysis, but it also takes a broader stance. It also covers different economic tools related to policy. And again, this is a research, academic journal that focuses both on research advancement, but also policy issues. And I will not say too much, but you can have a look at the journal homepage. There's a link here, and also like to just mention that very soon there will be a special symposium on contributions to the European conference last year in Toulouse. So that will be out in December this year. That's a symposium where we had Massimo Florio as a guest editor. So I would like to take this moment also to thank Kevin and Berchelt for setting up everything so we can have this webinar. Of course, I would like to thank Jason, Shogren, and John Hassler for accepting to be keynotes at the original planned conference, but also to accept to give the talks during this webinar. And also very grateful for Christian Gollier, my colleague here at Toulouse School of Economics, to accept to be the moderator for this event. And especially I'm very grateful to Johanna Gisler-Hammes, who is a senior researcher at the Department of Transport Economics at the Swedish National Road and Transport Research Institute, or better known as VTI in Sweden, for organizing this whole event, convincing Jason and John to be the keynotes and also be the keynotes today, and to be very generous and be offering to postpone the physical conference or in-person conference for next year. So thank you all. With that, I would like to hand over the word to Johanna. Thank you very much.
Well, thank you, Henrik, and hello, everybody. Yes, as Henrik said, my name is Johanna Hammes, and I'm one of the two main organizers of what was supposed to be the SBCA European Conference this year in Stockholm. And as we all know, 2020 didn't turn out quite the way we expected it for, and most of us hoped for, so we're having this webinar instead. And the purpose of this webinar is basically to keep the process going on, to do something to keep what will hopefully be a series of European conferences alive over this difficult time. I would like to start by also expressing thanks to John and Jason, who were expected to give the respective keynotes during the conference yesterday and today. That they have anyway taken time to be with us today and to share their thoughts in this different format. And I hope that next year they will be back at the conference and share even more new and exciting thoughts about the use of or makings of best benefit cost analysis. So as you've understood, we really hope that in about a year, we will be back to normal and we will be able to hold a European conference here in Stockholm. The dates have not been definitely decided yet. It depends on the academic calendar at the Royal Institute of Technology, which is the venue that we will be using. The conference is organized in cooperation between my employer, the Swedish National Road and Transport Research Institute, and the Center for Transport Studies at the Royal Institute of Technology. Some of you maybe have been to Stockholm and to the Royal Institute. Those who have not, it's a really beautiful place, and you should definitely come to see it and see Stockholm in the beautiful autumn colors that we have here at this time of the year. And some keynotes, key dates about the conference. We plan to open the submission system for the extended abstract on the 1st of March, and it'll close on June 1st. This way, the scientific committee also gets a little bit more leeway to do the work, and we hope to be able to send out the decisions whether your abstract has been accepted or not by the end of July, which means that the early bird registration will close in the beginning of September. I'm not going to go very much into what kind of papers we are looking for the conference. You can read the description yourself on the homepage, which you find at www.sbcaec2021.com. And the page is updated with new information when new information becomes available. So keep an eye on that. And also keep an eye on the Society's newsletter. The conference will be announced in that one too. So that was all I wanted to say. And the next speaker is our moderator, Christian Gollier, who is a professor at the Toulouse School of Economics. And Christian works with decision theory under uncertainty with applications in climate economics, finance, and cost-benefit analysis. He has a special interest in long-term sustainability effects, and his merit list is very long. I'm not going to go through it, but I thought I would mention that he's one of the co-founders of the Toulouse School of Economics alongside Jean Tirole, and has served as its director from 2007 to 15, and again since 2017. He's currently the president of the European Association of Environmental and Resource Economists and has published very much in top journals in economics. He's one of the lead authors of the last 2 IPCC reports and is the author of several books, etc. So please, Christian,
thank you, Joanna. Thank you very much for your nice word. And let me tell you, I'm very honored to moderate this special session. It's indeed too bad we are not all in Stockholm, but at the same time, this very particular situation associated with the coronavirus offer also opportunities, and the fact that we do not emit this tons of CO2 to join together in the same place demonstrate that there are also benefits to the situation, and I believe that that will continue like that in the future. So let me introduce very quickly this session on the coronavirus and the way economists have apprehended the situation. So we have seen in most countries that epidemiologists provide advice and recommendations to government to decide what to do in association with the control of the coronavirus. We didn't see many economists involved in that political process, and I think it's not very healthy, because I think economists can provide elements in the debate. In particular, as we have seen over the last 8 months, the economic consequences of the lockdown are critically important, and so the crisis is not only a health crisis; it's also an economic crisis. And it's important to combine the different dimensions of the crisis in order to make a good choice. And so I'm very happy to introduce today 2 prominent researchers who contributed a lot to the discussion, at least among economists, over the last 8 months. In particular, so we have Jason Shogren, who will present the first. He has 30 minutes for his presentation, and then we have John Hassler. So let me just introduce Jason Shogren right now, and then give him the floor before going to John Hassler. So John Shogren does not need much introduction, I believe. By the way, Jason was one of the co-authors of the first paper I ever read on the coronavirus in March. And so thank you, Jason, for introducing me to the topic. Jason is a professor at the University of Wyoming and chair of the Department of Economics. And in that university, he is also a member of the Royal Swedish Academy of Science. While he made his career mostly in environmental and resource economics, but especially in association to models related to self-protection and self-insurance in the spirit of Ehrlich and Becker on the use risk models. And I think what we want to tell us today is related to this long-term agenda research. Jason, the floor is yours for the next 30 minutes.
Okay, thank you. Thank you, Christian. Good morning, everybody. Good afternoon. I'm in Wyoming, and it's fairly early here, but I'm an early riser, so would have also preferred to be in Stockholm. But let's talk a little bit today about the research that we've done looking at the benefits and costs of COVID. And let me share my screen with you here, if I can get it right. All right, here we go. And full screen. How's that? Everybody can see it? Okay, so we started this back in March, and sort of the question was, this was a rapid response to a real-time risk. And the question we had now is, now in October, did the assumptions we made back in March turn out to be okay? Because I mean, cost benefit analysis, if you're doing it for the government, oftentimes has to be in real time. I spent a year in the Council of Economic Advisors at the White House for Clinton and Gore, and the key thing there was, oh, there we go, making sure that we had rapid response to whatever question the president or the vice president had in terms of different policy options. So in retrospect, if we had to do this all over again, would we do it like we did it? And I, say yes. And I'll try to justify why I said yes in terms of how we approached it, what we knew then versus what we know now in terms of COVID. So my whole career, the last 30 years plus, has been really trying to think about Ehrlich-Becker style endogenous risk models under different economic institutions. And I've usually typically applied it to most everything: environmental and natural resources, climate change, biodiversity, pandemics, health risks, ecosystem services, you name it, because what I found way back when is this tendency to want to separate out risk assessment from risk management, in the sense that the natural science does their job and then economists are asked to come in and mop up the mess by figuring out what sort of policies and costs and benefits occur, when it's truly the idea that these are jointly determined. Nature affects people, people affect nature. It's not a one-way street. It's a interactive system. We all think now about integrated systems, especially for climate change, but it's true for environmental health. It's true for human health. And so part of the big challenge for economists, and especially doing benefit cost analysis, is how do we add economic parameters into, say, epidemiological models, and how do we add epidemiological parameters into economic models so that we can have the feedbacks between the two systems. Because people aren't barnyard turkeys letting water run off their beaks. I mean, they respond either strategically, or they respond by wearing a mask or not wearing a mask, social distancing or not social distancing. And you see it all the time, of course, in the United States with all these different political rallies now in the middle of a campaign. Some places are separate, some places aren't. And these risk reduction technologies are, your choice of your portfolio of reducing a risk is going to be influenced by your preferences, your beliefs, relative prices, all those key things. For me, my year of living dangerously in 2020 has sort of tested my belief in all this endogenous risk theory, both rational and behavioral, in that I ended up in the hospital back right before COVID with an extremely rare segmented arterial something or another, in which my artery burst open that went to my spleen and nearly did me in. Extremely low probability, high severity event, got me thinking about lots of stuff. And then COVID came. And now, right now, today, actually, we've got a wildfire about 5 kilometers from my house coming in 2 directions. And we've spent the last 3 weeks, my older son and I, clearing out all the dead wood so that if it does come down the mountain, we got a better chance to not lose our house due to this wildfire. And so it's ongoing. Endogenous risk is real. It's pretty much driven my entire life. So when the COVID broke out, my wife, Linda Tunstrom, who is a behavioral economist here at Wyoming, we were sitting around in the morning talking to each other about, risks and this and that. And I was pontificating about all the risks that I've studied, blah, blah, blah. And she said, well, yeah, but are we overreacting to how we are approaching COVID with this social isolation and shutting down the economy. And maybe, you know, maybe the Swedes are, she's Swedish, and maybe the Swedes are handling it better with their sort of step back. Let's just to not quite go so crazy here with a complete lockdown. And as we were talking about that morning, out of the blue, I got a call from from Amy Harmon from the New York Times, who said, "What do you think about this COVID?" And so I made up some numbers off the top of my head, multiplying number of people dying by the value of statistical life. I was giving her some numbers, and she was getting pretty nervous as I was making things up and talking about things in a big perspective. And but she raised this question about what exactly are we doing and how do we do it? And both Linda and I looked for some kind of answers, some kind of guidance out there from somebody, and we're not finding it. Now, luckily here at Wyoming, she was already part of a team with Steve Newbold, who's a brilliant modeler, worked with the Environmental Protection Agency for the last 16 years before coming to Wyoming, and understands benefit costs and understands the importance of timely information for decision makers. Dave Finoff, who's a fantastic dynamic modeler, and Madison Ashworth, who's one of our graduate students. They already had a team together, and they're working on hesitance and resistance to taking vaccines. Why is it in the US that some people won't take a vaccine for measles, for example? And so they already had a team at work. And so we dropped everything to try to address COVID as best we could back in March for understanding the benefits and costs associated with what the trade-offs were involved. So some of these slides are going to be mixed up. Steve gave me some of his slides, and I'm going to pull in here as well. And so the question was, you know, is the attempt to slow the rate of COVID by social distancing worth the cost? Because we've been, you know, in the United States, we had a lot of pushback on this, especially coming from the Republican Party. But, you know, we had some questions about it in terms of the Democrats as well. And so we did not have any, we didn't really have any numbers. Now, if you spent any time in government, you know that the person who gets the number on the table first typically wins the argument, because you've got your number on the table and everybody else then spends the whole meeting trying to kick your number off the table. Well, if you can defend your number is still on the table at the end of the day. I learned that years ago, decades ago now, after having tried to kick numbers off the table with logic. Well, that doesn't always work. And so we pushed hard for this. And Steve's prediction for the Oxford Dictionary Word of the Year this year will be social distancing. We'll see. We can put bets on that, but that's his prediction. All right. So we took an SRI model, an epidemiological model, and we took that model as a way to look at projecting infections and deaths with and without social distancing. We then looked at the present value of lost GDP based on the projections of Goldman Sachs. Linda contacted one of the chief economists there who was willing to share their information with us, because of course Wall Street has a big impact on how the US thinks about the economy, but both on the stock market and just generally in terms of predictions. And so at the end of our story, we ended up with the net benefits of a social distancing policy being positive. So 5.2 trillion, let's just say it's positive, not worry so much about the exact number right now. And then we looked at the sensitivity analysis in order to cover our bases because there's a lot of uncertainty involved. And this is one of these sort of internal team discussions. I kept saying, look, we got a number, it's positive, let's go with it. That's all we need. And the more cautious parts of the group said, no, we need to do some sensitivity analysis, because what if we're wrong? And I said, nobody's going to know if we're wrong because we have a number. And I said, the number is the most important thing. Well, I lost that debate, thankfully. And we did our sensitivity analysis, and we'll talk about that briefly. Because what happens with a number, the governor from Montana took the number that we came up with and said, A, we're going to save a lot more lives, and B, it's going to cause a lot less damage to the economy. Well, that's not exactly the trade-off we were trying to explain to him, but as a politician who was promoting social distancing, this was win-win, right? We'll save more lives and we'll save the economy. There's no problem here, right? And this particular governor is running for the US Senate, so win-win was a good way to sell our results. But that's not exactly what we were doing. We were talking about the economy being impacted in terms of lost GDP, but higher in terms of net economic efficiency once we account for the willingness to pay for mortality risk reductions. Now, we know that GDP is not opportunity cost, it's not welfare the way we usually think about measuring welfare. We understand that. We didn't have time, right? This is one of these pragmatic decisions that to try to calculate the welfare losses of social distancing, the full spectrum, which might include domestic abuse because more people are staying home, depression because you've got less social interactions, all the different mental and physical impacts of forcing people to stay at home. We assumed those away or assumed they were separable and focused in on what we could measure quickly, which was GDP. Now, we could come back and add those back in. We also assumed away any kind of co-benefits, you know, the fact that the economy slows down, we're going to have less air pollution, we're going to have less, say, CO2 emissions on net. A lot of these co-benefits that are associated with an economy slowing down, we also did not look at. Not because we didn't think they were important, but because we didn't think we had time, because we really wanted to get some number on the I really wanted to get some number on the table because I really wanted to see whether or not it was worth it in a pretty rigorous but yet rough sense. So the SRI model, the epidemiological model, looks something like this, where you're looking at susceptibility, infections, and recoveries. You're looking at recovery rates, you're looking at contact rates, you're looking at the health system capacity, because that was the big discussion then, is that we were going to cap out our hospitals' ability to provide intensive care units, ICU units, and we're going to end up with people in the hallways and people would die because we just didn't have the equipment. So the whole notion of flattening the curve is to keep the curve below what the healthcare system can provide, and to push that push that threshold down so that we may have as many infected people, but we can at least treat them over a longer time horizon, right? And so this is the basic idea. Now, if you're an endogenous risk guy like me, you know that the contact rate beta is endogenous. You know the recovery rate is endogenous. It's based on your self-protection, your self-insurance, your ability to control yourself, self-control, your ability to wear a mask, even though that's a bit controversial, your ability to stay away from other folks. But again, those are details that probably affect the results, but we assumed away in order to assume just an exogenous contact rate and recovery rate, in the sense that the economic parameters are not feeding back directly into those parameters themselves, right? And of course, the basic reproductive number, the R0, the expected number of new infections by each infected person at the beginning of the outbreak. And so this R0 is the initial condition that's going to trigger where we think how risky this particular pandemic is going to be relative to other pandemics. Again, we don't have other risks in here. We just have the risk of COVID. Again, a fuller model would have a menu of risks and a menu of self-protection models. But again, we're assuming separability, and you can pick on that all you want, but that's what we're trying to do. Now, the net benefits of social distancing then are what you would think they are. The VSL, the value of statistical life, the marginal willingness to pay for mortality risk reduction. And essentially, we're just talking about what are we willing to pay to reduce risk, minus the expected deaths due to infection with and without social distancing, assuming social distancing is going to work, and the GDP in year T with and without social distancing and a discount rate. So it's fairly straightforward in terms of looking at the net benefits. Again, a little bit, we're adding apples and oranges when we're looking at VSL and marginal willingness to pay, and we're looking at GDP. But we are willing to go with it to give us an idea of where we're at. Right, so here's the basic set of parameters we used in terms of thinking about flattening the curve. So you can see in the graph, the spiked curve is the uncontrolled scenario. The flattened curve then is the controlled scenario. The threshold then is the threshold of healthcare capacity. So we're trying to push that distribution to the right. And the assumptions we're making about the R naught and the delta and the population and the rows that we're making. Okay, so based on our model, based on our runs, the number of infections in the controlled and uncontrolled scenario, the number of deaths then, so we predicted 2.18 deaths if we did nothing for the COVID, and so essentially 941,000 if we did control it. Now, that number's pretty high, 900,000. I mean, we're high now at 210,000 plus deaths, but we are not at the 900,000 level, which is just below what the world death rate is. But we'll talk about that in a little bit. So we're a little bit high on that end, but based on the numbers that were being kicked around at the time, it was not out of the ordinary, and it was not order of magnitude larger than what being predicted, because the models out of the University of Washington that the CDC used were very much looking at the same sort of ideas here. This was back in April or March, where the black distribution is the number of deaths with no intervention, and then the number of deaths with intervention is more like what we're seeing right now, 100 to 240,000. So our numbers back here are a little bit high. That's something that we need to think about in terms of why so high, and partly because, you know, we had assumed one rate of social distancing when obviously it's going to be heterogeneous, given lots of people have, some people are going to really social distance and other people are not. Age is going to matter. Underlying health status is going to matter in terms of the overall distribution of the US. If the US has more obesity, if the US is not as healthy as many other countries, this is going to have an impact as well. So as we look at that and we use the VSL, so now the VSL, of course, is pretty controversial. It always has been, but yet we use it, and we use $10 million, and we use $10 million based on what was being used roughly at the time in the US federal government. Now, I know there's lots of arguments about needing to adjust it for age, needing to adjust it for all the different factors that affect our willingness to pay for risk reduction, we picked 10 million. And we justified it based on lots of things. And we relied on Kip Viscusi's numbers. We relied on, again, the idea that this is the number that seems to be holding. Now, if you don't like the number, well, we also have worked on, with Lisa Robinson and Ryan Sullivan, different approaches. If you want to look at life years, Jim Hammett has worked on this quite a bit, and you can adjust that number. I'm glad we did the sensitivity analysis, because that gave us a chance to figure out a number on the VSL in which the net benefits flipped from positive to negative, and you can decide if 10 million is too much or too little. And I will say this, doing endogenous risk models with the VSL, assuming different levels of skill, I know that Tom Kniezer and those co-authors estimated that the VSL, once you account for heterogeneity and the ability to reduce risk yourself, it drops significantly. The number that sticks in my head is the VSL drops by 75%. I might be misremembering that, but it does drop significantly once you account for individual self-protection. Did we do that here? No. Didn't have time, or didn't want to make time, put it that way. We wanted to get this bottom number of the $5.16 trillion is what we're aiming for.
Jason,
yes,
you have another 10 minutes.
Okay, thank you. Calculating the costs, we used Goldman Sachs and we used McKibben and Fernando's predictions from their global model on what the impact would be without social distancing on world GDP. And so we made the assumptions about time and how GDP would drop, either with a fairly big V that looks more like a V than a U recovery. And we're assuming that with social distancing, there's going to be a more significant drop in GDP than without social distancing. Now, you can look at this new paper by Cutler and Summers that came out in JAMA a couple of days ago, where they've done an ex post evaluation of it. And given the US has been such a mess of social distancing some places and not social distancing other places, and state by state sort of decision making, they came up with an impact of about $7 trillion in terms of their estimate of the impact of what COVID actually did. So our numbers are not that far out of balance here in terms of nearly 6.5 trillion for uncontrolled and 13.7 for controlled in terms of the impact. So our ex ante predictions were not all that far off from where we ended up based on looking at Cutler and Summers' paper. You can find it. It's a short one, 2 pages that just came out. All right, so the sensitivity analysis, we explored different faster or slower recoveries. We wanted to look at whether how sensitive all this $5 trillion number was to changes in our different key parameters here. We looked at that one. This breaks down, I don't expect you to memorize this, but just what's the key number here, and I don't know how to grab it here. This VSL number here, that's the key one, is that at $5.85 million per life, if the value of statistical life is less than that, the net benefits flip, holding all else constant, assuming an equal rate of recovery under both the controlled and uncontrolled situation. If the uncontrolled scenario recovers faster than the controlled scenario or the policy scenario, the VSL goes up, and it goes down if the uncontrolled recovery is slower than the controlled recovery. So the results of the net benefit analysis really are sensitive to what we assume about the recovery rate of the economy. And the VSL, the more 10 million, if we cut it in half, 5 million, you can see out of 2 out of the 3 scenarios, our net benefits would have been negative. Now we'd have to justify that. I think Cutler and Summers justify going from 10 million to 7 million just to be conservative, but you could be ultra conservative and say $2 million, you know, and then in that case, in every scenario, we would have generated negative net benefits for social distancing. And so we play around with that with all the different mortality rates to give us at least some boundaries as to how plausible our numbers really are. But I wanted to focus in on the VSL because that one really is driving the benefit side. I mean, that's true in every policy in the US. If people are dying, having a VSL in there makes that benefits, well, it makes it large at any number of deaths times $10 million. And we go through the paper, the dot there in this graph represents the parameters. And then on either side of this separating line, we go from positive to negative net benefits. I'm not going to talk about this too much, but you can get an idea of what's happening here in terms of the sensitivity analysis, and you can look at it in the paper. So in our case, discounting works in reverse, right? Because usually all the costs are up front and the benefits are on the backside of most public policies. But in our case, the benefits are up front, the lives we saved, and the costs are coming in terms of this extended dip in GDP. We know that the parameters are not fixed and they're individual and endogenous to what people do. And again, that last question is confirmed cases are fewer than applied by the model we used. We're still trying to sort that out a little bit. Okay, so the take-home message is, again, this is an ex-ante analysis. The outcome's not guaranteed. We expect positive net benefits. And what was interesting is we sent this paper to my former colleagues at the Council of Economic Advisors in the White House, and they got it. They have this number. They had that number on their table, but they decided to do their own evaluation, and they ended up with a negative net benefits, for social distancing. Okay, limitations, we talked about those as we went through. Further research, well, let me go ahead for a second because I'm running out of time. In retrospect, 2020 hindsight, what might we have ideally done? We might have anticipated this. I would call it an irrational rejection of science in the US. I didn't expect that. We might have thought about optimal self-protection and the uncertainty associated with it. Way back in the 91 or something, I started writing about uncertain self-protection and how people would pay a protection premium to try to learn about how effective their self-protection was. That's definitely true when it comes to masks. There is so much confusion floating around, even though nature and science have reported different results. People are still, I was listening to the TV this morning where one guy says, well, masks, they don't work. And you're like, well, based on what? Well, I'm running for office and I'm a Republican and I just say they don't work, right? So optimal social distancing. Steve took the lead on a paper that came out in that special issue of Environment and Resource Economics, in which we tried to actually figure out the optimal social distancing with co-benefits as a way. And again, it's more detailed, but the punchline was the same. VSL being adjusted for age or for quality life years or this U-shaped. Again, that paper came out in risk analysis with Lisa and Ryan in terms of trying to figure this out. Willingness to test and super spreaders, are they less likely to test? And we found no, that pro-social motives matter. And this paper came out in Journal or Behavioral Public Policy. So we're trying to explore these boundaries to see what's happening. Rapid testing in contacts, vaccine hesitancy. I mean, right now, if in the US, if Trump said we've got a vaccine, would people take it? And about 70%, I think what's the number, 60 to 70%, somebody correct me, said no. Not if Trump says it works. We're just not going to believe him. If the CDC said it works, yeah, maybe we will. And these are people who vaccinate all the time. So the messenger also matters here. And then this underlying health in question. So back to the original question. Would we have done anything differently? I'm saying no. I mean, we needed a number. And you can either throw flowers on it or darts at it. I don't care. But I think we were willing to serve this function knowing that things would absolutely change. And if we're the target of let's knock this number off the table, that's fine. We can only do better science because, as I said, first number on the table has an advantage for policy. Would things have been different if we had found negative net benefits? Probably not to our federal administration, but maybe it would have to different state agencies and state policies that are not driven by ideology and probably driven more by science. And I think I just barely made it in my 30 minutes.
Yes, thank you very much, Jason. That's marvelous. Let me tell you again, your paper that I read probably early April was very influential, at least for me, and I believe for many others. You were long before Acemoglu and many other papers that came out in end of April and May. Yeah.
Well, I was just going to say, and it's published in the Journal of Benefit Cost Analysis. We initially sent it to Science and to PNAS because we thought it was a general interest, and they both rejected it because they thought the numbers were too risky. Well, yeah. I mean, you put ex-ante analysis of a pandemic. The numbers are going to be risky, but they were too risky for those guys, and so I'm grateful that we got an outlet to share this, and thank you to the journal.
So yes, so Jason, the question, but I don't want you to answer the question now because I propose that we immediately go to the next presentation. Okay. And then we will have a full discussion about all this at the end. But just to tell you, I mean, the big question is why are economists not heard in the debate? But I'm sure we will have a debate on that at the end of the second presentation. So the next presentation is by John Hassler. John Hassler is Professor of Economics at the Institute of International Economic Studies at Stockholm University. From December 2009 to December 2018, he was a member, and also in 2020, he was also a member of the Nobel Prize Committee for the prize in economic science. So an important person, but you know, I mean, he has published a lot in Economic Mechanics and Interview and many prominent journals. He worked as an advisor to the Swedish Ministry of Finance during the financial crisis and served as a scientific advisor to several Swedish government agencies. So, John, I propose that I take you the floor for another 30 minutes. And dear colleagues participating to the webinar here, don't forget that if you have questions, you have a chat, and we will collect the question and we will raise them at the end of the presentation. So make sure your question will be taken into account by just typing in the chat. So John, the floor is yours.
Thank you very much, Christian. It's great to be participating in this conference, despite we can't meet in real life. I was inspired by you, Jason, when you said that it's very important to get a number on the table early. So I went back and checked what I said in my blog posts mid-March about things like that. So I did it in a much more simple way than you did. And by the way, that's actually an advantage of having conferences like that. You can go back and check your web pages, and it looks like you actually are participating actively. But I did listen to what you said, Jason. And then I found that what I said at that time, which was just a very simple back of the envelope calculation, is very much along the same lines as Jason's actually. So at the time, I thought that kind of a reasonable guess on what the costs in terms of lost GDP were going to be was 10%. 10% of GDP was kind of a reasonable estimate of the order of magnitude of the costs in terms of lost GDP. And then I simply said that with kind of standard valuations of quality adjusted life years used in Sweden, which are actually a little bit lower than in the US, it's in the order of $100,000 per year, it would be worth it to take the 10% loss if we could save 500,000 life years. And at that point, it was kind of reasonable to believe that measures with kind of reasonable measures, that at that cost, it was possible to save so many lives. So I didn't have a clear number of the net benefit, but at least which actually surprised me, I found that even though the measures are extremely costly, also the benefits are of equal order of magnitude. And of course, orders of magnitude is enormously important to get right if you're a policymaker. So that's what I did at the time, and since then, of course, we have learned stuff. But my main assessment has not changed either. So there I agree with Jason. So what I'm going to do today is I'm going to give some reflections on the COVID-19 pandemic from me as a macroeconomist. I'm a macroeconomist. I typically do global climate economic models from a macroeconomic perspective. But it turns out, and I was actually supposed to talk about that here today, but it turns out that the kind of modeling framework has similarities with modeling the interaction between epidemiological parts and the economy. So I'm going to talk about that. I should also say that the work that I'm going to talk about is together with colleagues now and previously at my research institute is Timo Boppart, Kalle Harmenberg, Per Krusell, and Jonna Olsson. So after these reflections, I'm going to show the common work that we have done on what we want to call EPI-ECHO integrated assessment models, and I'm going to present some preliminary results from that work. But it's still preliminary. We have lots of things to learn, and my conclusion is going to be that at the next time we face a pandemic like this, we're going to have much better models that can give you more than just back of the envelope calculations. I'm a macroeconomist, and I think I want to kind of start by describing how I see the corona crisis from a macroeconomic perspective. And it's obvious that this is a very special crisis. It's enormously large. It's the largest and most globally synchronized economic shock we have seen for as long as we have had national accounts, which, by the way, started to be constructed after the Great Depression in the 30s. So in the second quarter, we have seen GDP going down by 5 to 20% in Western countries. Sweden 8%, Denmark about the same, Finland 6%, a little lower there in Finland and Norway 6 and 5%. In our neighbors in Europe, it's a little bit more typically. Germany down 11%, France 19%, Italy 18%, Great Britain 22%. US in the second quarter was down 9%, so pretty much like Sweden. Some of the developing countries, India and Brazil, are hit harshly, and in particular, the number for India, minus 24%, is of course extremely worrisome. Despite that said, I would say that it surprises me a bit that our economies are so robust to the kind of measures that we have taken. We have undertaken extremely harsh things to control the pandemic, and making people work from home, stopping people from traveling, having closed borders, lockdowns, and so on. And then nevertheless seeing that during the midst of these measures, 90-95% sometimes of GDP is still there. That surprised me. So I would say that we have a fairly robust economy. The global integrated economy is probably more robust than anything we have seen in history. Another thing that's different with the crisis is that we know exactly the reason behind the shock to the economy, and this is usually not the case. Some people say that it was Lehman Brothers bankruptcy that led to the Great Recession, the financial crisis, but that's of course still questionable. And the same thing, we don't really know exactly what caused the depression in the 30s. Here we know exactly what it is. Goods and services with substantial social contacts required in the production or the consumption should not be produced, or at least produced in lower quantities and or in different ways. So that implies that given the measures that have been taken to reduce the spread of the virus, the socially optimal level of GDP is lower. And that shouldn't be kind of stimulated back to normal. And this is also quite different from standard crisis, where kind of the loss of GDP is something that we don't want. Here, it's kind of a necessary part of the medicine that GDP goes down. And stimulus policy is then quite fruitless. And actually, even if it would work, it's not the right thing to do. I know that Boris Johnson tried to stimulate people going back to closed pubs with tax incentives, but that was simply stupid. So in many ways, economic policy have been playing second fiddle. So economists have been quite involved during the crisis, but playing the second fiddle, taking the health motivated measures as given and think about what's the right policy then. And as I said, it's not stimulus policy. And to understand what I think is the right policy, I think it's good to list what I think are the three central goals for economic policy during a pandemic like this one. And the first and perhaps most important policy goal is to short circuit the kind of self-reinforcing feedback mechanism that can lead to a depression. And these work through, increased uncertainty, lower asset prices, lower house values, and so on. That leads to lower consumption that feeds back. And in particular, these feedback mechanisms that work through financial and housing markets are known to be extremely dangerous. So this has to be stopped. The second goal is to prevent that the crisis gives long-term damages to the economy. And the way I usually phrase it there is that the economy, in order to work, needs physical capital, human capital, man hours, and so. That's what we usually model. But it also needs links between agents in the economy. Links between firms and their employees, links between firms in supply chains, and links between firms and customers. And these links are essential, and they are costly to build if they're broken, and they takes time to build them. And so we want to prevent breakage of these links, and this is done by trying to prevent massive bankruptcies and layoffs. The third goal is to make sure that we redistribute as much as possible these necessary reductions in income that come from the measures in a fair way. And clearly, not everyone works in sectors where there is lots of social contacts, and it's very obvious that different sectors in the economy and different individuals have been hit very, very differently. I guess most of us in this conference hasn't been hit at all, at least by income reductions. What's interesting to note is that, in contrast to many other situations, the key goals for policy during the crisis are not generally in conflict with each other. They kind of, if you rather the opposite, that they help each other. If you redistribute better, that's going to lead to less bankruptcies and layoffs, and it's probably also going to help in making sure that you don't get this strong self-reinforcing feedback mechanism, and vice versa. Another thing that's important to note is that most of the good crisis policies are bad policies in normal circumstances, helping failing firms, paying people not to work, and so on. And it's then important actually that we end these policies when the crisis is over. And I often get annoyed by people saying that we kind of, with crisis measures, we can kind of hit two flies at the same time, because I don't think that that's right at all. I think the most of the good policies during the crisis are things that we should kind of end when the crisis is over. How is it gone then with these second fiddle policies? Well, fairly good, I would say, at least in Europe. We have actually generally not seen the self-reinforcing feedback mechanism operating. Although at the beginning of the crisis in April, we didn't really know exactly what was happening. But with retrospect, you can see that we were on the way into these mechanisms starting to be operative. The stock market fell, consumption fell, across the board, not only on these things that kind of were had to do with contagion, but we with strong measures from, in particular, central banks, we managed to short circuit these feedback mechanisms, and also we haven't seen many bankruptcies in the Western world, neither in the US. In the US, we've seen many layoffs, but not in Europe. Worked hours has gone down across the board in Europe and the US, but layoffs have been so far fairly mild. Not in the US. On the other hand, maybe that's less of a concern with the more flexible labor market that the Americans can benefit from. But the crisis is not over, so we kind of need to continue with these crisis policies that should be ended, and stimulus policy is not yet the right policy. And actually, if we succeed in achieving these three goals up here, I don't think that we need a stimulus policy to kickstart the economy anyway. But that's to be seen. Okay, so this is policy when the economics play second fiddle. But I don't think that economics should play the second fiddle. I think that we can actually be part in maybe not play the first fiddle, but at least be kind of interacting with the ones that analyze and decide health policies. And you often hear politicians saying that health is not traded off against the economy. That's simply wrong. Obviously, it's done, but no. So far, very few politicians have dared saying it, and I think that's pretty unfortunate. We need to kind of understand that, as always, we need to make trade-offs, and I think there we need kind of to help in producing analysis and models that can evaluate the consequences of different pandemic policies and effects here on general welfare and its distribution, not only, of course, on neither GDP nor on health. So obviously the pandemic and the policies against it, as I said, that has affected the economy in dramatic ways. But it's also, and Jason pointed to that, the case that economic activities in the broad sense are the key determinants of the dynamics of the epidemic. So what I think we need is integrated assessment models of epidemiology and economics, and I want to call them epi-eco integrated assessment models, and describing the feedback between the dynamics of the disease and economics. And these such models can maybe produce better forecasts, but more importantly, I think they can allow a comparison of different policies, also in welfare terms. And as I said, I was going to talk about ClimEco integrated assessment models. That's what I usually do. But here, the kind of models that I'm talking about or have substantial similarities. So let me just kind of give you a picture of the kind of models I work with usually. So there we have the interaction between climate and the economy. And we have an economy model, and it's a long-run growth model. It has to be global because climate change is global. In the model, lots of stuff happens. Consumption, leisure, and equality is determined by the choices of individuals and other agents in the economy. In particular, the government sets policies and so on. One of the outputs from the economic model is CO2 emissions that goes into a carbon circulation model, and which then produces a path of CO2 concentrations in the atmosphere, which goes into the climate model and produces global warming, which affects the economy through health and damages to the production capacity and in general to welfare of individuals. And the epi-eco integrated assessment models are very similar in many ways, and the modeling tools are similar. We have an economic model where consumption, leisure, and stuff is determined. And one of the things that is determined is the amount of social interaction. And that then becomes an input to a model of the epidemic, and leads to then the dynamic representation of health outcomes, infections, which feeds back into the economy. So many things are similar. One of the kind of key differences is, of course, the time scale. In some of the models that I work with usually on climate economics, the time step is a decade. Here, it's a week or a day. So that's, of course, very different. But otherwise, many things are quite similar. So what these models, should they kind of contain the epi-eco integrated assessment models? Well, you need a model for the epidemic. And we, like Jason and most others, use kind of SIR-like models that distinguish between susceptible, infected, and recovered. And you need to kind of to detail the extent of interpersonal contacts here, and also kind of model other measures taken, hand washing, masks, and so on. And it's, of course, quite important to have a sufficient degree of heterogeneity in the model. I guess all models have at least young and old, but we have learned during the crisis that heterogeneity is probably much more important than just distinguishing across age. The economic model is fairly standard to economists, but we need to, of course, have a new focus that's usually not there, at least not in the models that I work with, namely that households take into account the health consequences of their decisions about consumption, work, and leisure. And we need to introduce both then voluntary and also mandated measures against getting infected. And of course, we have to take a strong we have to specify the amount of information people have, to what extent they are rational, and what kind of norms are developing. So for some of these stuff, certainly economists are not the experts. We need to learn from in particular sociologists. But I think what's important here is to note that during the pandemic, and this was stressed also by Jason, the epi and the econ parts are rooted in each other, and so they interact. And I think also an important part of these models is that the models can answer rather than just assume how behavior is changed when the environment is changing. So, for example, different policies are changing, but in particular also the risk assessment that people make from different choices they do. So the data that's used, we need to use data. The model has to be quantitative. It's kind of obvious in this group, of course. And for the echo part, we use standard macro data, but also data on time allocation and, of course, health. And the epidemiological model use various epidemiological facts as inputs to it, and we try to kind of match data as good as possible. And in the data should discipline the model in the sense that you shouldn't kind of have too many degrees of freedom in the model, so you can match data exactly. The model then is a sort of a lab. We can specify policies and we can make different assumptions about the future and so on, and solve the model and derive output in terms of consumption, health, time use, and so on, and more generally life quality and its distribution for the different assumptions about policy. And I think this can be done without really necessarily making normative analysis. I know that cost-benefit analysis necessarily is normative, but I think the value of these models is not only in terms of normative statements, it's also kind of just showing the consequences of different policies without really making assessments of exactly how you should evaluate it is important. But of course, we can also, in the usual way, by assigning a social welfare function or valuing different things here, go into normative analysis. So let me come to our epi-echo integrated assessment model. And I think we have, did you say 5 or 10, Christian?
I said 10 maximum.
My speaker was down here. So what? I'm sorry. What did you say?
Okay, I said 10 minutes maximum.
Okay, 10 minutes maximum. That's going to be fine. So what our model is a bit of a response. We are slow. We are not at all as fast as Jason and his colleagues. So we are slow, but then at least we have the advantage of maybe not kicking what you did from the table, but certainly we can add some stuff that we think have been missing so far in the literature. And what we think is important is to, in the economic model, really take seriously that virus transmission happens when people spend time together. So we need to kind of to model time use explicitly, and also understand that how people use their time is a conscious choice. So what we do is that we kind of classify, in the simplest way you can do this, time use as private, non-infectious, or public infectious, and what we also assume is that when you consume, you need to spend some time in addition to spending on the good or the service that you use. You need actually to spend time also, if it's private by watching TV, or if it's public, for example, by going to the restaurants. And what we think is also important, that the combinations of spending and time, be it public or private, is not necessarily in fixed combinations. You can kind of spend, you can change by choice, by government choice and also individual choice, the combination between time and spending. It can kind of be more or less time intensive per unit of spending if it's, for example, public. Okay. Time is also used for working at home, non-infectious, or socially in the workplace, infectious, and in the production then of different kinds of goods and services, private on the one hand and public on the other hand. Also here, we think it's important to have some degree of substitutability. So homework can imperfectly substitute for social work in the production of goods, in particular goods, but perhaps also, no, actually also services. So we have 6 different uses of time that are then imperfect substitutes, and policy and the precautionary motives affect how individuals in the economy allocate their time over these different uses. And what we then assume is that it's the infectious time, the time spent in social interaction, that drives the epidemic in the epi part, and this is going to then be kind of a choice by the agents, so directly. So it's not directly linked to how much you consume of different kinds of goods. It's more a direct choice of how much of public infectious time agents are allocating their time to. So of course the model is very stylized, but and it should be more, at this time at least, viewed as a proof of concept. So this is the kind of, I guess you've seen it before, this is the kind of data that we use as input. So this is public and private leisure time used on different kinds of things, and this is the kind of data that we used kind of to have a starting point for the time allocation. So what we do is in the model to compare a couple of different scenarios, and so far we have looked at 3 different scenarios or assumptions here about what agents do. The first one is myopic, so people don't respond, they are unaware of the epidemic. So this is kind of not, this is meant to kind of to show how important it is to take into account that people do react to information about the epidemic. And we do that by having, by looking at the case when people don't understand that their choice of social interaction affects the likelihood of getting infected. Then fuller information is kind of the opposite. People rationally understand how their behavior affects the likelihood of getting infected, and they change the behavior accordingly. They're going to be willing, of course, to take some risks, but they choose themselves how much the risk they're going to be wanting to accept. We also analyzed optimal policy, and it turns out that even if people take into account the risk that they themselves get infected, they are not, at least not in this, under this assumption that we use here, taking into account that they can spread the disease to people outside of their own family. So that externality needs to be corrected by policy. And we also analyzed different assumptions about the value of a statistical life year, different epidemics. I'm going to show you hopefully some pictures on the SARS and the influenza also. So this is what we get in terms of infection dynamics. So here we have days from the outburst of the pandemic, and here we have fraction of the population infected on the vertical axis, and this is in the myopic case. I have a red line here, and that's the assumed health capacity, and what we assume is that if the number of sick goes above this, death rates go up and eventually double. So this is what happens if you have full information. Then you can in particular see that that it's the old, the dark brown here that change their behavior, not so much the young. This is if you introduce optimal policy, and you see that it's quite a big difference. You want to stay, and it turns out actually you don't go into the health system capacity. You stay well below it when the government impose policies that make people internalize the externality, namely the risk of spreading the virus to others. So this is kind of the trade-offs then, death versus GDP under the three scenarios. And to the left, we have the cumulative number of deaths in percent of the population. And you see that myopic behavior leads to kind of pretty bad outcomes. If people don't understand that they should protect themselves, you get much big number of deaths than in the rational full information case. But you need to go further. Having a stricter policy, which is seen in the right-hand side, where you see that if you just let the pandemic run over us, we don't lose much GDP. It comes basically from the health effects. If people don't take into account that they should protect themselves. With full info, you get more. So after some time, infection is spreading and people decide not to work as much, to spend so much time on public time, and that has a negative impact on GDP. But it's much bigger when you impose the policy. 2 more minutes. This is if we instead parameterize the SARS, and then it turns out that lockdown is optimal. So you can see here that immediately you shut down the economy, causing an immediate reduction in GDP by 40%. So this is flow rates. And that has a quite dramatic impact on the number of deaths. But you see here also that taking into account voluntary behavior is important in both cases, actually, both for GDP and for death. This is the seasonal flu. And here, on the other hand, it's not the right policy to have very harsh lockdowns. You see that to the right here, that GDP with the policy is falling more than what people voluntarily choose, not taking into account the externality, but it's kind of relatively mild in the order of 1% rather than 20-30. By the way, and that's going to be my final word before I come to the conclusion, these things are, of course, very sensitive to how we value life. And when we kind of took the upper end, so like $10 million per life as the value of a life, then it turned out that you should shut down the economy also for a flu. And we thought that kind of put some doubts on using such a high number. So we went down. We are still kind of in the range where various agencies and people use. So I think maybe this is a third or something of that. But we thought it kind of, this gave some impression that society is probably not, since we don't shut down the economy when the flu comes, we are not really putting as high value of a life when it comes to these kinds of things as sometimes suggested. But this is just from observation. I don't claim to make any moral things here. So I think there is a strong case for using these kinds of models, and apart from getting a number, putting down the model also clarifies what's missing, and I think that cumulative process is very important, actually. We certainly need more cross-disciplinary work, and one of the things to understand social norms and behavior and so on from our kind of the people that we usually collaborate with, but we also, of course, need more input from the epidemiologists. One thing that we had problems with is to get better estimates of the substitutability between public and private time use. So basically, how much less productive are people when they work from home rather than in the office? And that was difficult to get to know in real time, but the pandemic is gonna teach us something about that hopefully will be useful in the future. Thank you very much.
Thank you very much, John. Congratulations, that's a very sophisticated, rich, and interesting paper that you will be able to write within 6 months. That's such an achievement. So congratulations. I have many questions for the two presenters this afternoon, but I'm sure there will be also the questions from the audience. Let me start with me as I wait for questions from the chat. Many questions. So how your model, and here I talk about both models, the one by Jason, the one by John, how your model could be applied to a possible second wave. So I would like to hear you on that. I'm very impressed, John, by the fact that, in fact, the rational solution already do a lot, in spite of the fact that my intuition is that the epidemic and the pandemic is mostly a problem of externality, of epidemiological externality, and you have the vector of transmission of the virus, and the fact that people do not take into account, rational people don't take that into account should matter a lot. And you seem to suggest that's not the case. That's not so much the case. Yeah, so let me go back to the basic question I had at the beginning, and it's for the two lecturers this afternoon. And I have been impressed by the fact that economists have not been heard over the last 6 months in terms of policy recommendations. I mean, in France, I think in the US.
Is that the case in France? I would say that in Sweden, you hear economists talk being kind of pseudo epidemiologists all the time. So I think we are stepping a little bit outside of what we usually what we should do. But maybe that's different in different countries.
I see. I want to hear you about the difficulty for economists, contrary to epidemiologists. For economists, the big question is the value of statistical life. And I think both of you expressed the view that putting a value on life is important. We have those values in our public decision process, but it is not the outcome of a political or a democratic process. I mean, this value has been decided by experts, and there is no legitimacy to that. And the consequence is that economists that are not really heard because their main instrument, which is in the trade-off between GDP and life, we have the value of statistical life, and this is an expert decision. It should be supported by a democratic process. And the fact that it has not been supported by a democratic process generates a difficulty for us economists to be heard on that issue. And so why not trying, and here I address the question to the people from the association, the Society for Benefit Cost Analysis, why not trying to support an appeal for a public debate on the value of statistical life in the US, in Europe, in Sweden, in France. I wrote a newspaper article in Le Monde in April expressing the fact that we need to make those trade-offs between life and GDP, and therefore we need to have a democratic debate. And by the way, in France, the value of statistical life is 3 million euros. And when I wrote that in a newspaper, I must tell you, until I got a quantity of aggressive reaction to that was quite impressive. So I would like to hear you on that too. Also, one important element, in particular in March and April, but it's still true today, we still face a lot of uncertainty about the basic parameters of the SIR model. It would be good to integrate in the integrated assessment model those uncertainty from the beginning, rather than making sensitivity analysis. In particular, when this sensitivity analysis demonstrates that depending upon the value you put in the parameters, you get positive or negative net benefit. So I think introducing uncertainty in the modeling is important. Of course, there is the question about what do you think about the Swedish strategy, or more generally, what do you think about the age-specific lockdown strategy? Should we, given the very different probability mortality rate, should we try to target the lockdown to the people who produce less GDP and face a larger mortality risk? I would like to know on that. Also, maybe, and that's probably more for John, given the sophistication of his model, what do you get in terms of duration of the lockdown or the social distancing and the intensity of the social distancing? Is it better to go very strong at the beginning of the pandemic in terms of an intense social distancing, in order with the objective to reduce the duration of the negative impact of this social distancing on GDP, or should we rather expand this duration in exchange for a reduction of the intensity? That's probably related to the debate about whether we should flatten the curve or should we try to suppress the virus. Something that has been tried, I think, in Europe in different countries last spring. Let me stop at this stage. I don't know who of you want to start. Maybe Jason, because I didn't hear you for some time now.
Well, I'll say about the VSL. I mean, there are some folks on the Zoom that are more experts on the VSL than me, and I know that in some ways the VSL is like a big sledgehammer in the US. If you want to pass the rule that we're going to eliminate diesel fuel, or we're going to try to push it out, we've got 10,000 lives saved and we multiply it by 10 million, the benefit side gets huge just right off the bat. And so in some ways, you know, the pushback on VSL has come from different factors to including economists. Trudy Ann Cameron is try to argue, get away from it. I know that, her name just went out of my head, worked at the World Bank for a long time, tried to reverse it with the idea of what is the cost to save a life and think of it more in terms of cost effectiveness. And so the value of life, at least right now in the US, is still in there, but the pushback that I can see on COVID is now you're comparing the value of life to the value of no tyranny, and that's the word being used around the US for the no masker group, and the, you know, the sort of the Trump community is, well, you guys are trying to put a value on lives, but you can't put a value on freedom, and you can't put a value on the reduced tyranny. And you know, and a lot of my friends, I've got a lot of musician friends, both on the left and on the right. And it's amazing, all these people that I know on the right-hand side who would otherwise be very rational approaching things, just absolutely see it as an incommensurable that you would try to force anybody to do anything, even though we have plenty of laws that do that all the time. No shirt, no shoes, no service. And just adding no masks to that is all of a sudden crossing a line that they will no longer cross. And they don't really care what the value of statistical life is, because to them, the value of freedom is infinite. And now you got dueling infinities, and now we're back to square one, right? And then it becomes part of the political process, because, you know, I mean, this always comes up. I'm protecting children. Well, I'm protecting children who raise endangered species. So I have double infinity versus your infinity. And benefit cost doesn't work too well when we're in the world of infinities on both sides of the equation.
But at the same time, in March and April, it was clear that the crucial key trade-off was between revenues and value of and lives. And so, yes, I agree that you can always complexify problems, but at least in April and March, the debate was about how do we value life.
Right. Yeah. And so I think given that the biggest impact initially was on the elderly, then the question is whether or not we're going to adjust value statistical life for age or not. And as part of the Science Advisory Board for the EPA way back when, that always came up. And it was politically untouchable, at least in the US, to make adjustments for age, even though most economists would make that argument. And so the quality of life years, or using the life year estimate like they do in Sweden, makes sense, and that other people have advocated. The idea that we're going to shut down the economy for the flu and we don't, based on $10 million a life, that would be a great analysis to do in the US as well, to say maybe that 10 million is too high. I'll stop there, but let me just say one thing about incorporating uncertainty into the models. Yeah, if we had time, absolutely. We did this for pesticide work, in which we simulated, in this case, groundwater and surface water models for pesticides across the United States. And we ran these models hundreds of thousands of times and built a meta function for these models, in which we would incorporate all the uncertainty into that meta function, which then, like the integrated assessment model, that function then incorporates all the different landscapes, all the different weather patterns, all the different uncertainties into it. But nowadays it's way easier. This was 30 years ago. So getting those computers to chug out 100,000 runs to create these simulation models that we could then put into one functional form took a lot of time. And perhaps we could do that for these SRI models as well. Just run a whole surface and then be able to capture it in one functional form, so the uncertainty is embedded in the model itself. That's worth doing, and probably can do it a lot quicker than we did 30 years ago.
Thank you, Jason. John?
Yes, first on the valuation of lives. Yeah, as you said, Jason, we kind of here it's not been controversial to use life years, quality adjusted life years, and that's used a lot by the agencies. I was quite a lot in media and so on talking about these issues, and I always use this kind of cost benefit analysis and talking about the quality adjusted life years and so on. And I didn't get much bashed actually for that. So, but I think maybe that is because my conclusion was that, you know, we should really do heavy things here. And so my conclusion was that kind of the things that we did was right, and maybe we should do more. Had the conclusion been instead that no, the costs are too high, we have to kind of let 10,000 people die, then probably it would have been difficult to say that. And probably so difficult, so, you know, expecting that politicians would say that right out, even if everyone understands that that's what they mean, I don't think we're going to have democracy. Doesn't work that way, unfortunately.
That's a framing issue too, right?
Yeah.
How many lives are you saving versus how many people are you die?
Oh, that's right. Yeah.
And we
the consequences
at any cost. And
so you are telling me we should give up the idea to have a democratic debate on the value of life. I disagree. I think if we are unable to legitimize some kind of a trade-off value for life, economists will not be able to have contribute to the debate on that. In particular, at the critical time of crisis, as we had in March and April.
I think we can contribute, and I think you know, if we point and consistently talk about how we do this in other circumstances, that we when we construct roads and so on, and when we decide whether a new drug should be paid by the government and so on, I think it's a value, and that to kind of try to get that question on the table all the time in normal circumstances, because I think that helps. And so that's what I did. I kind of pointed to how do we do this in normal times. I didn't claim that that's necessarily the right thing during a pandemic, but it helped actually to say that let's see how we do this in normal times and take that as a starting point for the discussion. And had we discussed this more with the help of economists, I think that would have been beneficial. Targeting different groups, well, and let me actually say something about the tyranny issue. So in our model, and I guess in most models, including yours, there is a tyrant, right? There is a central planner that decides exactly what to do. But we think of that as kind of a modeling trick. But here I think it's actually quite important to think about decentralization. How is this implemented? And you can do that in many different ways, and some are less tyrannic than others. Maybe we can think about how could we make it easier to behave in a way that you internalize things. How could we kind of foster norms and so on in an efficient way? Maybe taxes is at least less taxes on kind of behavior that we want to reduce is less invasive on privacy than just forbidding people from doing stuff. I don't know, but I think this is the in general, it's very important to think about how we decentralize an optimal policy, and in this case, I think it's even more so. Targeting different groups, yes, of course, that's very important, and our model so far doesn't have sufficient heterogeneity there, but to look at that in detail. But I was quite impressed by how the Danes did in a very simple way immediately in the crisis. I think this was done in late March. They put together a group of epidemiologists and a group of economists, and they then ranked different sectors, first in terms of their contribution to contagion, and then by the economist by their contribution to the economy. And then you could kind of combine these measures and try to see if there were sectors that had contributed little to contagion and much to the economy, and they should be open, and vice versa. So even simple things, I think, there is very important, but it requires requires still kind of the cooperation between academics that usually do not cooperate. But that might be different in the future. Then on the timing, well, you saw that the timing was quite different depending on whether we used parameters from the pandemic and from SARS. SARS was kind of a very harsh, immediate lockdown. So what kind of policy is optimal depends on the parameters of the pandemic. And also I would like to stress that it depends on what you assume about the vaccine. And this again resembles very much the climate economics, that what is the optimal climate policy depends very much what you assume about the backstop. Is it coming? Will it? If it comes, when will it come? Optimal policy and the green paradox and all these things depend very much on that. And that's of course the same thing here. And there, I mean, it's hard to say. And clearly, we know from these models that if you can be fairly sure that the vaccine comes quickly, that tends to generate that, imply that a harsh lockdown is better. Otherwise, without the vaccine ever coming, it's not much we can do. And then the only concern is the health capacity that you should try to be below. Otherwise, you can't really do anything in the long run. Like in the case of climate change, if there is no backstop, we need to, the only way we can get energy is from fossil fuel.
Thank you, John. So I didn't hear you or Jason talking about the second wave, given the fact that the rate of susceptibility is still between 80 and 90% in our population. We are the if we have the virus again in the population, should we do exactly the same thing as what we did in March and April, or should we do something different? You know that you probably know that in many different countries, the resistance to a second lockdown will be much larger than during the first wave.
So I'm going now a little bit outside of my area of expertise, because I think this really hinges on the assumptions about heterogeneity in transmission and susceptibility. If there's a strong heterogeneity there, then maybe kind of the super spreaders have already got the disease. They are not so important to consider anymore, and this has a completely different implication than the opposite, with more homogeneous parameters for both the risk of a second wave and what's the optimal policy. But I haven't really done that in my models, in our models, so I can't answer more than that.
Okay, so Jason, do you want to contribute here at this stage, or do I move to questions from the audience?
Yeah, I guess my only assessment here is, ideally, I would love to have individual self-protection embedded in the model, which is more down this time commitment that we've been talking about here, and how people spend their time and the effectiveness of self-protection, because it seems like a big part of that is that people are solving the problem themselves, and you trust that they're solving themselves, and they're solving it rationally, and there's enough collective trust and enough collective rationality, then there's no need for another lockdown. But if you don't have the trust, and you don't perceive the rationality, and you perceive some lack of science or some acceptance of science, then yeah, then the bottoms up approach is really going to be a problem, unless, like now we're talking in the news today about herd immunity again, and that's just a whole other ballgame.
Yes, indeed. I have different questions from the audience. Different questions related to the value of statistical life. First comment by Jim Amit saying, and he's right, of course, that the value of statistical life is not determined by experts, but it's the outcome of the econometric analysis of observed behavior or market price. So I think it's perfectly right. So another set of comments related to value of statistical life and the degree of fear. Here I'm not completely sure to see what the meaning there. But yes, so we need to adjust the baseline, taking into account the degree of fear in the population. And there is also a question by Lida Robinson. To both, I think, to both participants, to both lecturers, but in particular to John, how time is valued in your model? And let me address a special comment to Jason. Jason, you see on your slide, you seem to discount the loss of GDP, but you don't discount the value, the loss, the lost value of life, the value of lost life. So I was a little bit surprised about that, but maybe I didn't completely understand what you said at this stage. So John or Jason, what's the value of time in your model, John?
Yeah, well, I think the way we're considering lives saved were immediately, as opposed to saving lives over the next 30 years. We're saving lives today, as opposed to the GDP being impacted over the next 30 years of recovery. And so that's how we rationalize that. In terms of Jim's comment, yeah, VSL is not set by the experts. I was sloppy in my language. I should say that we all have our own trade-offs in our own heads, and the experts essentially come with a thermometer and try to measure that trade-off and then aggregate it up, is really what I should have said. And to the degree of fear question, I think that's related again to the preferences for endogenous risk. I mean, you have preferences over lotteries and you have preferences over lotteries over lotteries. And once you start thinking about preferences over lotteries, now you're dealing with fear and how does that affect your optimal portfolio of self-protection. And so all those are another layers that ideally you would want to fit into the model, because to me, that's what's missing in my mind, that's what is missing the most, is the endogeneity of skill to control risk and the ability to understand how to do it and how that affects things. And if it knocks the value of life saved down significantly because people have figured out how to save their own life, that would be good to know.
Okay, John, you want to contribute here?
Yeah, so on the time issue, so it's a relatively standard utility function where people value they value leisure and consumption of private and public social goods. And the only twist is that usually leisure is thought of as just having time, but we say that in both consumption of goods and services and leisure, you need both goods and services and time. So that's kind of just the only twist. So kind of that's aggregated into a relatively standard utility function where we, since we're thinking about here the value of life, have an additive term that kind of represents the non-consumption, non-leisure value of life to get kind of the total value of life, right? So there, I would say it's relatively standard, and we know fairly well how people value time spent in for example leisure. So there I think we don't have any problems there. We can use standard models. The problem is really with the elasticity. So if you need to work more from home, how much is productivity reduced there? If you kind of need to kind of change your leisure so that you spend more time in your leisure privately than with other people, what's the utility loss of that? That's more difficult, and we have just made sure that the model replicates what we see without any pandemic, and have used guesswork for the elasticities.
Yeah, John, I have another question by Henrik Anderson here. He observed that there have been many different lockdown policies, particularly in the Nordic Scandinavian countries, and still similar loss in GDP, and same thing in Europe. So how in your model do you, how do you translate the health policy, the social distancing policy, into GDP loss? What's the what is the model? So it depends. In the rational model, people themselves stop to work, and that has an impact on GDP.
So I should say first that the model that we presented is kind of stylized. So it's not a particular model of Sweden. So it's still quite stylized. And I guess so Swedish policies are, I think if we talk about, so if the question is about what we do in Sweden, what we have done in Sweden, I would say that often it's a bit exaggerated, the differences between Sweden and other countries. It's true that we haven't had the lockdowns for people in when they are not working, they are not forced to be at home, but the policies that affect the economy and the voluntary changes in behavior have been fairly strict here too. So it's not, I don't think it's not surprising to me that we have as large GDP falls as say Finland, Norway, and Denmark.
Okay, so I think we should close this this session soon. Let me provide my own conclusion to this meeting. I think in general, the public opinion believes that economists would explain that the economy is something very important and that should matter more than life, and therefore lockdown should be opposed. And it's good to see that here this afternoon in the webinar, both Jason and John came out with the conclusion that the lockdown is important and is optimal. So I don't think whether it's your own conclusion, but I think at least that's one of the critical common ground of the two papers today. Provided, given the fact that the two models were quite different by construction, I think the fact that they provide the same recommendation is quite useful. So let me conclude at this stage, that we take a last check on the chat. I don't think that there is still a discussion about the BSL and the necessity or not to discount value of statistical life. But I think this is enough for today. So thank you very much for all of you for this participation, and thank you for the Society of Benefit Cost Analysis to have organized this event. See you soon, preferably in present. Bye-bye.
Thank you, everyone.
Thank you, speaker. Thank you, Christian.
Bye-bye.
And thank you. Finish with a joke. I was talking with a Norwegian friend, and he said that they were really tired of this lockdown. They really wanted to go back to the social distancing of 2 meters instead of the 1 meter that the policy in Norway was. So finish with that.
I thought that was I thought that was in Finland.
Finland as well.